You in or out?
I'm out.
Stone cold bluff. You might want to spend a little more time paying attention to your cards and a little less time staring at my breasts.
They don't match either.
Talk about hitting her where it hurts. I think House intentionally lost the hand though, because he knew that this patient doesn't have gastroenteritis. If he leaves it to Cuddy, she's just going to stay and play, and the patient will get more and more unwell. On this channel, we have reacted to the first batch of House recommendations by you. Now it's time for batch 2, bigger, better, crazier diagnoses. Let's see what this episode House All In is about, and if I can guess the diagnosis before House does. Let's get started.
Do you need help? Or find a security guard? I really have to pee.
I think you are. You're bleeding.
Oh my god, if you see blood, do not stick your finger out and touch it. Think of blood like the pigsty of the human body. You don't want to know what viruses could get in through a cut in the skin. But either way, this child has a bleeding which is profound, very dangerous. Children can look like they're okay 1 minute and the next be very unwell. They have squeaky new, clean, autonomic nervous systems, unlike our rusty old adult nervous system. They can compensate for huge losses of blood, and then once they hit a critical level, become very, very unwell, just like that. There is some things that this could be. We don't really have many clues yet. Looks like the child is 11 or 12, would be susceptible to gastroenteritis, but he looks well. It doesn't seem to be infection. He's not vomiting. Could be first presentation of inflammatory bowel disease like ulcerative colitis or Crohn's. Could also be inherited bleeding disorders like hemophilia A or B, which is also known as Christmas disease. A little late for that Christmas reference. And it could be ITP or even a rare rectal tumor. Or maybe it isn't that at all. Maybe he's just had red-colored paintball that exploded in his pants. We need more info.
You in or out?
You know that relative to their size, gorillas have smaller testicles than humans. Reason is, primate testy size inversely corresponds to the fidelity of our females.
You know you are witty when you don't need sarcasm. You don't need low blows. You can use true facts from the animal kingdom to insult your opponent. House is all in. That primate fact is true as well. I remember reading that paper at the turn of the millennium. Basically, chimpanzees have the largest testicle size in proportion to their body because of how unfaithful their females are. There must be something just irresistible about that bright red chimpanzee bum. And humans are in the middle of the range because, sometimes we're faithful, sometimes we're not. Gorillas are the most faithful animal. And so they have the smallest testicle. The reason why is because the sperm quality needs to adapt to meet the competition, to make it more likely for that male to mate. Obviously, if a female is mating with more partners, then the competition is higher. So lads, you may not want those elephant-sized nuts as much as you thought.
I'm all in.
Bloody diarrhea. Hemodynamically stable, but he's been developing some coordination problems.
It sounds like gastroenteritis and dehydration. Order fluids and I'll take it on my service.
It's firstly unlikely that gastroenteritis is the case here, but if it is, then it isn't usually hemorrhagic like this. The cause in this case though could be a bacteria called E. coli 0157, which causes gastroenteritis but can lead to systemic complications like hemolytic uremic syndrome or Henoch-Schönlein purpura, and also dysentery, which is where you get blood in the stool. If that's the case, then this kid is going to go into kidney failure soon after. He will need urgent blood tests, including a blood gas, antibiotics, and a stool culture. I would hold on the head scan considering the radiation dose is quite high, and especially for a developing child, that could lead to more lifetime risk. But you would definitely want to give IV fluids if he's struggling to keep things down because you want those kidneys to keep a good blood supply. I've seen a patient permanently disabled by E. coli 0157 haemolytic uraemic syndrome on pediatric in Macclesfield as a medical student. The patient was one of the only ones on the ward in the summer on pediatrics where it is a ghost town, and then the winter gets totally packed to the brim. He needed a lot of rehabilitation, but at the end ended up going home all right, thankfully.
You in or out?
I'm out.
Stone cold bluff. You might want to spend a little more time paying attention to your cards and a little less time staring at my breasts.
They don't match either.
Talk about hitting her where it hurts. I think House intentionally lost the hand though, because he knew that this patient doesn't have gastroenteritis. If he leaves it to Cuddy, she's just going to stay and play, and the patient will get more and more unwell. She wasn't really taking it seriously, so I think he's left straight away to go and see that patient. But that's the thing about being a doctor. Fun time has to take a hit sometime. Luckily we have on-call shifts, so we usually get some notice before we get called into the hospital. But if you're a surgeon and who you operated on is unwell, then guess who they're gonna call, even if you're not on shift. That's right, it's not your Aunt Linda.
I want you to reach out and grab my cane.
I knew House lost her hand on purpose to come and help the patient. See, not all heroes wear capes. It looks like what he spotted here seems to be something called Nystagmus. It's the jerky eye movements, and then he's also got past pointing, basically where the sun missed the cane. They're both what we call cerebellar signs, which is deficits in the little brain, just below the brain, that controls coordination. Some other signs we remember using that acronym called Danish. D is for dyskinesis, where patient can't do this. A is for ataxia, where they can't walk or coordinate. N is nystagmus, which is the jerky eye movements. And I is intention tremor, where you are tremoring when you're reaching out to something or moving. S is for cut to speak, where you stutter while you're talking, and H is for hypotonia, where you basically can't keep the tone on your muscles when you're moving it around. It just feels as though everything's too loose, there's not enough resistance compared to usual. Now, if the child is breaking down his red cells in haemolytic uraemic syndrome, it could lead to a stroke in the cerebellum potentially, but that's not reversible, so that makes me think that's unlikely. Or it could be a sign of uric acid buildup, or potentially another totally different condition, maybe a demyelinating disorder like Miller-Fisher syndrome, which is reverse Guillain-Barré. Now that would be very spicy.
2 cases, same symptoms. What do 6-year-olds and 70-year-olds have in common?
This kid doesn't have kidney failure.
He will.
The kid just ate some bad food.
I knew he was going to develop kidney failure. To be honest though, children and elderly are affected together by so many different conditions. Some other examples are things like ulcerative colitis or leukemia, a type of hematological malignancy that have double peaks. But these tend to be in like the 50 to 60s age groups rather than the 70 to 80s, which, I mean, House is saying that it's the elderly. There are some others that have a double peak. Surprisingly, the incidence of STIs in the elderly, which is sexually transmitted infections, increase when they move into nursing homes. So don't drop a Kama Sutra there. The healthcare service is already overloaded, and so is Aunt Betty.
I was treating a 73-year-old woman who went through this progression of symptoms, the last of which was, in case any of you missed that class in med school, that one's untreatable.
Okay, so this is looking more and more like haemolytic uremic syndrome, which is secondary to E. coli 0157 to me. The bacteria produces a Shiga toxin, which is also less commonly produced by Shigella, that causes clots in the small blood vessels, which basically leads to a triad of hemolytic anemia, acute kidney injury, low platelet count. By giving antibiotics or loperamide, you actually increase the risk of a gastroenteritis leading to hemolytic uremic syndrome, and so that's why we don't use it, and it shows the dangers of unnecessary treatment. Hemolytic uremic syndrome actually has a mortality rate of 10%. At this point, I would want to do a blood test with a culture, sigmoid or a colonoscopy, and an MRI scan of the head with a lumbar puncture because of the ataxia, which is now of unknown origin.
It's not Erdheim Chester.
Can we go back to the party?
Do a kidney biopsy. Esther's shut down and exactly...
This kid is not Esther. You screwed up. She died.
Looks like they've done a colonoscopy on the kid and they found what seemed to be a blood blister tested for this condition called Erdheim Chester, which House said his previous patient likely died from. It's a type of haematological malignancy that is very slow growing. But yeah, the test is negative. Seems like House was traumatized by this past experience and he wants closure from it by using this child. The team think that he's gone totally bonkers, but I know that he's gone bonkers. But now for the kidney biopsy, more clues please, Sherlock.
E. coli HO157 causes bloody diarrhea and leads to haemolytic uremic syndrome.
Completely plausible. And exactly what I did last time. Didn't work.
Damn it. At least I got that 10 minutes before Chase did. I'll take that, even though it was wrong. Now I feel like I need to think laterally. So what if the bloody diarrhea isn't bloody diarrhea at all? Okay, that leads me nowhere. Okay, well, we got to work this out. We know he has kidney failure, which can be pre-renal, renal, or post-renal. It's unlikely to be post-renal because he's not in pain. Unlikely to be pre-renal because he actually looks well. So it could be renal, which is a type of glomerulonephritis. The rectal ulcers can be caused by lupus, which also causes a glomerulonephritis. But the colonoscopy was clear, and it's also never lupus. Hematological malignancy is potentially another option. It's still on the cards, but we would need to see that on a blood test. So let's have a look.
If he has lymphoma this far advanced, we should be able to see it in his blood and brain. Chase, run a blood smear and immunochemistry, confirm and get an MRI.
Oh, so hematological malignancy seems to be a possibility here. It's one of the worst diseases because a child who is previously well can end up hugely debilitated from it. I remember in pediatrics, I saw a 7-year-old child who'd gone through chemotherapy, had lost all of her hair, but she was the strongest, most inspirational kid I'd ever seen. Her parents were crying on the side of her bed and she was comforting them. But thankfully, she went into full remission from her leukemia, which it was a pleasure to be involved with. We sometimes think that kids need to be sheltered all the time and they can't handle things. But when we experience challenges like this, we're often surprised by how much they can truly take. And they show their colors, which are brilliant.
Push her all in.
Go. 2 pair.
7 of clubs. Sounds like I messed up.
She is having the time of her life while her patient is fighting for their life, but it's for the best. Because Cuddy makes a hugely insightful metaphor for the bureaucracy of the medical system sometimes. It tries to protect people, but on many occasions the bureaucracy ends up doing quite the opposite. There are times when policies don't actually make sense and we still need to follow them. To give you an example, during the COVID pandemic, it was banned at the beginning for any medical practitioner to wear a mask before they were going into theatre or anything like that. On the wards, we in the cardiothoracic team decided to wear masks and protect ourselves, as many other countries were doing, and we were told off by higher ups on multiple occasions. And then 2 weeks later, it came down as government guidance that every doctor and patients as well should be wearing a mask in hospital and even outside of hospital. So that just goes to show that even though we were early, we actually got punished for that. Goes back to this saying, which is the tall grass gets clipped, which couldn't be more true.
I can't breathe. What? What's happening? Oh. Ian, come on.
Oh, it's getting serious. The MRI found a mass at the base of the brain and blood tests were negative for lymphoma. House decides he's going to treat for everything again, which always ends in tears. Then Ian's platelets have started dropping and now he's going into respiratory arrest. Just a normal day at the office. I've seen a 3-year-old child need to be intubated because of a presumed asthma attack before. The airways are tiny and once a pediatric arrest call goes out, about 20 people turn up ready to go. Even in the NHS, where the whole hospital only has about 14 employees, as the news will try and tell you. Now, interestingly, in recent news, a child actually had died from an asthma attack and the coroner had decided, as the parents had suggested, that it was due to London's poor air quality. So low emission zones seem to be the way into the future.
He makes antibodies that are eating the inside of his arteries, choking off blood to his major organs one by one.
Can anyone think of a reason why Kawasaki's can't affect the elderly?
Kawasaki's disease. Damn, that is a good shout. I didn't think of it, but neither did the rest of House's team, so I'll take it. But to be honest, I don't think it's Kawasaki's. And I will tell you why. It causes fever, rash, redness of the whites of the eyes, and swollen lymph glands in the neck. Usually affect kids under 5 years old, which this kid is not, and by this point his heart would have exploded if he had Kawasaki's. So I would bet my medical degree on him not having Kawasaki's.
You read Moby Dick?
It was a book?
It was 10 years ago.
12.
Obsession is dangerous.
Only if you're on a wooden ship and your obsession is a whale.
House drops more metaphors than a poetry competition ran by English teachers. Doctors are into literature though in general. I remember one of my consultants was asking me about the classics once, but being a true millennial, I had no idea. Like Catcher in the Rye, Great Gatsby. Yeah, I've seen the movie.
Coronary arteries clear. No aneurysms.
Flip the mode. Let's see the flow.
Phew, I can keep my medical license. It's not Kawasaki's. Although I love how Chase can do echoes now. He's 30 years old and he can do about 5 different advanced specialty skills. What does he do? Like beg consultants at 2 o'clock in the morning to teach him their skills. No wonder he's called Chase.
Small, but it's there.
Esther didn't have a mass in her heart.
The kid can't take any more theories.
So intracardiac mass, low platelets, kidney failure, PR bleeding, brainstem mass, ataxia. How does it all fit together? He could have a genetic condition that predisposes him to tumor growth or something like multiple endocrine neoplasia or tuberous sclerosis, neurofibromatosis. Also, could have radiation exposure, vasculitis of the large vessels, or it could be lupus. Anyways, let's watch House take a chunk of this kid's heart out. I'm sure nothing can go wrong there.
These procedures would be so much simpler if you could get them on healthy people. And out again.
Cardiac arrest.
Come on, paddles.
Oh, a mandatory cardiac arrest is here again. Now, it's quite impressive that the monitor is accurately showing VFib, but the sudden change from sinus normal 80 beats per minute to VFib is a little unrealistic, especially since he had a catheter going into the kid's heart, and that irritates the pacemaker cells of the heart and usually causes them to move quickly. So and 80 beats per minute for his age is still, you know, a little bit small. Even if he was chilling, never mind having a medical procedure.
How much longer are you going to keep doing this? Clear. Wait, got something. He's back.
Okay, that Risa situation was all wrong. No chest compressions, 49 electrocutions. That boy is more likely to turn into charcoal than be revived. But here he is. I love it. It's brilliant. Let's watch more.
Jesus were hiding all along. Testing for Erdheim Chester disease.
Oh, this is a disease the house thought of right at the start, but it didn't seem like they biopsied the right part. Erdheim Chester disease, as I said earlier, an incredibly slow growing haematological malignancy. It causes overproduction of cells called histiocytes, which usually protects the body from foreign substances, but their overgrowth can cause all of the symptoms listed, and it can occur at any age. I think this is a slam dunk house needed, but so rare that there have only been 500 cases ever recorded.
Take your time and say it loud.
CD68 positive.
Oh, I said hematological malignancy as well. I was right, although could have been a little more specific. It is Erdheim Chester disease. What an outlandish call, and he gave us it right at the start. The writers slow played us with that. This whole episode was basically a bluff. They gave us the answer right at the beginning, and we kept on guessing it, and boom, it was there in front of us all along. Universal Studios, give yourselves a clap. Of course, none of this is real. None of it would happen in real life. But do I care? No. It's a TV show. It's made to entertain, not to be a documentary. And it does that brilliantly. Are you not entertained? I sure am. Now let's fix this boy before we go full gladiator and he bites the dust.
You got lucky. You gonna call?
What I do, it's not just based on the flip of a card.
You guessed. You got lucky.
It fit.
Everyone, no matter how smart you are, needs a healthy dose of luck. In medicine, we play with risk all the time. Even when giving dose of a friendly neighborhood penicillin, our patient could end up in an anaphylactic shock. Ultimately, we never know which card we're going to turn over next. You can never eliminate chance 100% of the time, but the smartest people work so hard that chance becomes on their side, not working against them.
You know, relative to its size, the barnacle has the largest penis of any animal.
And on that note, go watch another episode here. Stay curious, but not house curious. That's a bit too curious.